Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to be going over sleeping positions and how they affect your spondylolisthesis pain. Hopefully this affords you some pain relief. Enjoy. So a sleeping position is a key element of trying to reduce the stresses on your lower back and spondylolisthesis pain. Many times spondylolisthesis is aggravated when we have an anterior pelvic position. We've talked about this in several of our other videos. An anterior pelvic position is where the pubic bone is lower than the tailbone. And if you don't set yourself up correctly in bed when you're about to go to sleep, this could definitely aggravate your spondylolisthesis during the 6 to 8 hours that you're sleeping every night. If we're laying face down and trying to sleep, the body has a natural tendency to extend or overarch the lower back. For most people, that's going to put compressive forces on the back portion of the disc and facet joints in the back, and gravity is going to assist that spondylolisthesis segment to sag forward or to move forward, which of course is the whole problem with spondylolisthesis. So this is generally the most intolerable position for most people to sleep in. You're usually better laying on your side. And when you are on your side, many times spondylolisthesis sufferers will flex the hips and the knees to decrease that arch in the lower back. This definitely opens up the back portion of the disc and the facet joints and can relieve pain. But the negative to this is that sleeping in this position all night long tightens the hip flexor muscles. The hip flexors like the psoas, the iliacus, rectus femoris, adductors, TFL, ITB, these all tighten when the knees are forward. So the key with keeping your legs forward if you want to reduce spondylolisthesis pain in side position sleeping is to make sure that the knees and hips are only bent enough to afford relief. Even an inch of difference can make a big difference in how tight those hip flexors become overnight. I also would like to have my knees and ankles stacked one on top of another, because if one leg is more forward than another, it's going to create tightness in our adductors, which are the muscles that run from our pubic bone and pelvis down to the inside of our leg. And we've already learned in other videos how that tightness can then augment the forward tilting posture of the pelvis and aggravate spondylolisthesis. So try to keep the knees on top and the ankles on top of each other. It'll also help to reduce a rotational stress into the lower back in that position. When we lie face up to sleep, many people also like to keep the knees and hips bent. Many times putting a slight pillow or a rolled up towel or roll under the knees allows that lower back to decrease its arch, to flatten out and to decrease the stress on the spondylolisthesis segment. However, again, because those knees are up, that's tightening the hip flexors. So when you wake up in the morning and stand, these are going to be more tight. It's going to tilt the pelvis forward, and that's actually going to aggravate your spondylo the next day when you get up out of bed. It's far better to try to reduce the pillows or the roll under the knees and take your hands and place them at your lower back level. And then once you're lying down and you organize yourself so you're level, so one pelvis is not higher than another, so that's not you're rotated to one side, but nice and symmetrical in your posture. You want to keep your hands from your lower back and use them to slide down your lower back and past your tailbone, which will help to flatten the lower back out. So what I'm doing is I'm just using my hands to kind of scrape the skin from my lower back downwards and then upwards once I get to the buttocks, which takes my whole curve in my lower back and brings it into a flat position. Then the friction of the bed and the mattress will hold in that position as my legs come down. I can do that again once my legs are down. Start in the lower back, gliding down and under. Helps to reduce that curve, and then I'm ready to sleep. Keeping these tips in mind will help you to decrease the overarching effect of the lower back, as well as the excessive flexion in the hip flexors, and make your sleeping posture a lot better in decreasing the mechanical forces that aggravate spondylolisthesis pain. If you like this video and would like to learn more about spondylolisthesis, healing exercises, postural implications, feel free to subscribe to our channel. We got a lot of great videos there. If you'd like to help me share this vital information with others, give me a thumbs up below. Any questions or comments, please leave them. I'll do my best to get back to you, answering your questions on spondylo or other back pains. And remember, we've got our great new spondylolisthesis fast track healing exercise program, which goes over all the stretches, conditioning exercises, postural and daily activity advice to decrease your spondylolisthesis pain. I hope this video helps you with your sleeping position and decreasing your lower back pain.